It's been requested that I do another video on shoulder pain and how I get results in one visit. It is from the Carrick Institute, Trigenics, which a bunch of fancy words, which some very smart people, a lot smarter than I am, figured out that especially with the shoulder, we do it with the knee, we do it with the lower back as well. But the shoulder is what responds really, really fast, especially frozen shoulder, where you can't bring it above 90 degrees, you can't reach all the way back to the wall, you can't really get into your back pocket, can't wipe your butt. That's the number one, sorry, but that's really the number one complaint. The way we do that is that the shoulder has all these different muscles, rotator cuffs, right? And so some of them will become extremely weak, some of them get short and tight. So you have a big muscle underneath your arm called your lats, your latissimus dorsi. It allows you to bring your arm down or pull yourself up. That one gets really tight. And when it's really tight, you will not be able to lift your arm up. We actually lengthen that through neurology. There's certain neurological reflexes that when we do certain procedures with it, and it's just using certain Golgi tendon organs, a bunch of fancy stuff, and it's very difficult to explain without showing it. But I can't show it on screen because, well, I'm not allowed to. But either way, it lengthens those muscle fibers instantly, and so then the weak muscles, we can use neurology to strengthen them instantly. So like your deltoid, the one that allows your arms to pick up. You've got subscap, which gets really, really tight, won't allow you to reach all the way back. We stretch that one. It's very painful. The procedure can get a little painful. In fact, there are certain cases where we have to stretch it out over weeks. Sometimes we have to use different therapies like stem cell therapy to allow especially if you have adhesive capsulitis, to actually go in there and start to heal some of those that scar tissue up. We can use stuff like shockwave therapy to break up those adhesions. But 9 out of 10 people, if you can get your arm to 90 degrees, you can touch the wall behind you and you can touch your side. 90% of that time, we can get you at least 30+% improvement in range of motion and 30 to 50 to 75% decrease in pain on day one. In fact, I am putting together a package right now. I got interviewed on a national podcast yesterday that I was saying one of my dream goals in the next 12 to 24 months is to actually my main passion is to get people back into the outdoors, bow hunting, fishing, hiking, kayaking, whether that's, and especially if they can't do that due to knee pain or shoulder pain. I would love to have a package to where you could come to Arkansas, Northwest Arkansas, fly or drive, spend a week, Sunday through Saturday or Sunday through Sunday, whatever. You come in, we do treatments all week at our clinic, but in the meantime, we have world-class trout fishing here. We have thermal hog hunting. We could do 1 or 2 afternoons, 1 or 2 nights. There's hiking, there's boating, there's 3 major lakes within an hour drive. I'm thinking about trying to put a package together. That's gonna take some finesse. It's not gonna be cheap, but if that's something, if you wanna come get your shoulder fixed, get your knee fixed, spend a week, do some thermal hog hunting, do some fly fishing, do some trout fishing, do some bass fishing, some crappie fishing in the beautiful Ozark Mountains, I'm gonna try to put that package together very, very soon. Anyway, I told you I'd do this video. I will try to do a little better, more detailed one very, very soon. This one's almost 4 minutes long. I gotta shut it off right here.